In health news, a recent report made major headlines linking alcohol to cancer. The report from the U.S. Surgeon General said alcohol drinks should come with cancer warning labels, and doctors agreed, saying that they support it since many patients underestimate the risk. So joining us now is Dr. Natasha Bhuyan, National Medical Director of One Medical. This was really interesting because on the one hand, it didn't really surprise me because we all know that excessive drinking obviously is not good for you. But on the flip side, to cancer. And I think that was, they likened it to a carcinogen. And when I think of that, I think of, like charcoal or something like that. But what was your reaction to this?
I mean, look, alcohol is actually the third leading preventable cause of cancer after smoking and after obesity. 90% of Americans know that tobacco causes cancer, but only 45% of Americans know that alcohol causes cancer. And so really this paper in the Surgeon General warning, it's more about awareness that alcohol is linked to cancer, just like obesity, just like tobacco. And the Surgeon General did point out that there's 100,000 cases of cancer every year and 20,000 cancer deaths that are linked to alcohol. So it's something that we should take seriously.
Right, and they have in fact linked it to 7 kinds of cancer.
Yes, exactly. And so when we think about the cancers that it's linked to, so it's the ones that where alcohol goes. It's the throat, it's the larynx, it's the esophagus, but it's also places like the colon, there's breast cancer risk as well. And so it's a couple of other spots too.
So that was interesting to me. I mean, for those who have a history of breast cancer in their family, what should they know?
Well, so alcohol impacts our cells in different ways. One of them is alcohol can actually increase our estrogen levels, and that's what increases the breast cancer risk. But alcohol can also damage DNA, damage protein, and so alcohol damages our cells too. Now, what people should know is that we don't know what the safe level of alcohol to consume is. This is what I found the most surprising. For a long time, doctors have said if women have 1 drink a day and then have less
or like
than 2
red
drinks
wine
a day,
or something like that, it's not bad.
That's a safe level. But now studies are showing even if someone drinks 1 drink of alcohol a week, that could increase their cancer risk. And so I think it's important to be mindful of thinking about alcohol like tobacco. There isn't really a safe level, but we also know that the more you do drink, that does increase your cancer risk more. So there's a direct correlation.
Okay, but let's be honest. There are still tons of people, millions of people who still want to have a drink. And we're not talking excessive drink, but maybe it is that once a week or occasional week or not occasional week, but occasional drink or celebratory drink.
Exactly.
So what do we do?
Well, so here's what I'm telling my patients. It's really hard to tell people to abstain from alcohol entirely. Most people won't follow that. So the best advice is to reduce your alcohol intake because that will reduce your cancer risk. The other thing to be mindful of is what's your overall health and your overall baseline risk of cancer. So if you're someone who eats healthy, you exercise, you don't have obesity, you don't smoke, you don't have much of a family history, having an occasional drink is fine. It's not going to significantly increase your risk because your risk is already low. But on the other hand, if you're someone who smokes and you have obesity and other risk factors, you should talk to your doctor because overall it means your cancer risk is high. So I think this again is individual and tailored to each person to decide what they want to do.
Yeah, not a one-size-fits-all.
Exactly.
Great advice. Dr. Natasha, thank you.